Hi, welcome to Save With CPR. My name is Drew Toma. I'm a paramedic and I'm going to be one of your instructors today. I want to welcome you to this life safety training today. Now, I know that this may be viewed as a burden. This is oftentimes a requirement of your employment. But I want to go over something really quick because I'm going to ask for your attention, and I know that's a lot to ask for. Almost 500,000 Americans die every single year from sudden cardiac arrest. If you're going to have to do CPR, the statistics are that it's about 80% chance of having to do it on somebody you know, right? A staggering amount of CPR has to be done in the home. As a career paramedic, I've gone to a lot of calls. I've seen a lot of people perish who unfortunately did not need to perish, right? The training that you're about to receive today saves lives. It just works, right? The number of times I've had to hear a mother scream, my baby, because they died from an overdose when the parents were right there. In this training, they could have saved their child, or loved one, or spouse. I know it's not fun. I know it's going to be painful. It's not going to be painful. We'll have fun. Do me a favor. Just pay attention, please, right? Like, the statistics are pretty clear. You're going to leave the classroom today, right? Like, this training's going to be over. You're going to go back to your day-to-day life. There's people you live with. There's people you care about. And, life's going to happen. And if you pay attention to this training, some preventable things that kill people, you can fix, right? And so people don't have to always die, and this training can help fix that. And so I just ask, please give us your attention, engage with the videos, engage with the hands-on skills, because I've seen so many people who've died, and the people on scene who cared very much about them, had they had this training, they could have prevented the death, right? So I'm sorry to start off this training on such a morbid note, but hopefully that gets your attention. Okay, so what are we going to go over today? Well, this video is the foundations video, right? And so this foundations video is going to lay the framework for the rest of the training that you might see. So let's take a look at what we're going to cover. We're going to go over your safety, right? Because if you get hurt trying to save somebody, then you can't save them. So that's no good. We're going to talk about recognizing an emergency. How can you respond to an emergency if you haven't even noticed one, right? We're going to go over calling for help. Right? A lot of times I've seen people get kind of tunnel visioned on, an emergency. Most people aren't familiar with these, right? Like, I, as a paramedic, see this every day, right? But chances are you're not going to have to call 911 all too often in your life. And so how do you even recognize that emergency, right? And then we're going to talk about age ranges, which is specific for the CPR training of this. We'll then talk about consent. This becomes very important when it comes to first aid and when it comes to choking relief. We'll then talk about Good Samaritan laws, how you're protected legally in pretty much all of the states. And then we're going to review what we covered, right? So this foundations video will lay the framework for us as we continue through the rest of our training. Thank you. So your safety, right? It's really important that we recognize that we have to remain safe as rescuers. Right? If we just rush into an unsafe scene, if we rush into a building that's on fire, we rush into a confined space where there's a limited amount of oxygen, if we rush into a hazardous material spill, we're going to become harmed. Right? Now we add burden to the rescuers. We add up to the morbidity and mortality count. And so if we're not being smart, we just rush into a scene without being mindful, we may become a victim now ourselves. And so it's really important to make sure that your safety always comes first. Even if somebody's injured, if you going in and rescuing them causes harm to yourself, you can't do that. That's unsafe. Right? So never enter an unsafe area. How can you recognize an unsafe area? Well, if you see multiple people who are ill or injured, chances are that there's something that's affecting a large number of people, so you probably shouldn't go in there. Right? Especially in industry where you have a confined space and a limited supply of oxygen, or if that atmosphere is hazardous through chemicals or toxins or poisons, don't go in. Right? If a building is actively on fire, that building's going to be hot inside, and there's also going to be poisonous gases. So you can get cyanide poisoning if you rush into a burning building. Also traffic, right? Motor vehicle collisions. People are not paying attention on the road. So if you see a car wreck, pull your car to the side, get your family out, get yourself out, stand on the other side of the guardrail, because unless traffic has stopped and slowed down, you're likely to get hit. A lot of first responders and tow truck drivers get killed every single year because people aren't paying attention on the roads. When you go to do a rescue, wear what we call personal protective equipment. Right? These are tools that help protect you. Gloves, right? So make sure you're wearing your gloves. Make sure you take your gloves off appropriately. You'll see a video of that on the screen. Also, make sure that you're washing your hands. Right? See a sink, use a sink. So wash your hands for, I'd say, at least 30 seconds. Use running water. Use soap, and then grab your paper towel and then shut the handle off. Because when you turn the handle on, you got it dirty. Also, when you're doing CPR, right? If you're doing mouth to mouth on somebody you know or care about, understand that you may receive a communicable disease by putting your mouth right up to their mouth. So when you give rescue breaths, you could use a mask, you can use a mouth to mouth barrier, you can use a bag valve mask, which we'll talk about in our CPR section. If somebody's actively bleeding, right, wear eye protection so the blood doesn't get into your eyes. In EMS, we have a saying that if it's warm, wet, and sticky and not yours, don't touch it. Right? And that kind of really allows it to sink in that you don't want to get a communicable disease, especially when you're trying to render aids. Your safety is very important. You should be starting your rescues by making sure that you're safe. So here you're going to see the responder come up, assess the patient, recognize that they need to render aid, and you'll see them apply gloves. So you apply the one glove, then you apply the second glove. If you've never done this, it's worthwhile to practice. That way you can do it effectively and quickly in an emergency. After a rescue, it's important to properly remove your gloves and then wash your hands. So here you see one glove being taken off, but the glove is grabbing the other glove so as not to touch your hand. You only grab the glove. Then you start to pull the glove off, and then you can come around and with the clean part of the glove, grab the dirty part of the other glove to remove it. Now it's time to wash your hands. Make sure that you use an antibacterial soap and warm running water. It's important to wash your hands using friction with running water for at least 30 seconds. Notice how you're getting all of your fingers under your fingernails, up the wrists a little, and then notice when the washing of the hands is done, you grab paper towels, you dry off, then you use those paper towels to turn off the faucet as the handle may be dirty. Okay, so now let's talk about recognizing an emergency, right? Like you can't go render aid if you don't know that there's an emergency. So what are some things that can kind of point out an emergency to us? First is I would say use your instincts, right? If something feels off, it probably is off. Right? If you see somebody who's not responding, if you see somebody who's not moving, it doesn't look like they're breathing. If you see somebody who's bleeding, right, losing a lot of blood, that's absolutely an emergency. If you go into an area and you see a bunch of people ill or injured or unresponsive, you need to leave immediately. Right? That could be an atmospheric poisoning, such as carbon monoxide. That could be biological terrorism. Anytime you see a large group of people suffering from the same kind of set of symptoms, you don't want to be in that environment. It's also important to understand that chemical leaks in confined spaces, right? If you see people not moving, if you see fluids or chemicals leaking from containers, you don't want to go anywhere near those. Okay, so what do you do in an emergency? That's awesome. Just call 911, right? Throughout the country, the 911 centers have what's called emergency medical dispatch or EMD. So what that means is when you call 911, right on your cell phone, 911, put it on speaker. They're going to ask you questions, right? And as they ask you questions, they'll get a better understanding of the scene. In a lot of places, they'll be able to provide you specific instructions, right? Move the person out to fresh air, give them aspirin, control the bleeding with direct pressure. So if you forget everything else in this training, just remember, call 911, put it on speaker, and help will arrive. That's how you'll save the day, okay? Now for age ranges. This will be important when it comes to CPR training. So age ranges, we consider adult victims 8 years and older. We consider child victims from the year of 1 to the year of 8. And infants are considered 1 and below. This will become important when we talk about hand placement, compression depth, when we talk about compression to ventilation ratio. So remember, infants are ages 0 to 1, children are ages 1 to 8, adults are ages 8 and above. Let's talk a little bit about consent. Right? Consent is a person who is mentally and legally competent, able to make their own decisions, agreeing to what happens to them, agreeing to the care that they receive. So if a person is alert and oriented, you have to get consent first. Right? And this can be very simple. Are you okay? I know CPR and first aid. Could I help you? If they nod yes, right, this is the international sign of choking. If they nod yes or they say yes, they've given you permission. But if they say no, you really shouldn't touch them. That could potentially lead to assault and battery charges, depending on the state and circumstances. If a patient is unresponsive, there's a concept called implied consent. So anybody who's unresponsive and unable to verbalize consent, they have implied consent. That means that an otherwise reasonable person would want to receive help. So if somebody is unresponsive or unable to give consent, that means you're able to help them. So how are we going to stay protected? Well, that's the Good Samaritan laws. All 50 states have a form of Good Samaritan laws, and what those allow is for responders who are rendering aid, so long as you operate within the level of training, you're not doing anything crazy outside of the norms, you're not actively trying to hurt people, you're going to be legally protected. So you'll be protected from liability if you're trying to help people in an emergency. What you're not protected by is if you get hurt yourself. Right? So if you're not wearing PPE, you don't wear gloves, you get a communicable disease, you have no protections. You get objects in your eye, you get hurt, you get cut, you get hit by a car. Unfortunately, you're not protected. That's why your safety is so important. When you go to render aid, you have to make sure that you're not going to become a victim yourself. So let's review. I'd like you to go through the student manual right now and try to answer these 5 questions, or talk amongst yourselves and try to answer these questions to review the material we've just covered. Thank you. I'll see you soon.